Ну, теперь наша очередь. Глубоко уважаемые коллеги.
Dear colleagues and guests, good morning. Let's the session of the Dissertation Council for the defense of the dissertation by Shapovalova, Ekaterina, Andreevna, seeking the degree of candidate of medical sciences in the specialization 140101, Obstetrics and Gynecology, on the topic uterus-sparing vaginal mesh-based reconstruction of the pelvic floor for the anterior-apical prolapse clinical experimental research to be open by the Act of St. Petersburg University dated 29th July 2019. I now read Eriko Alexandrova, Doctor of Medical Sciences, Professor, Head of Department of Gynecology, Obstetrics and Reproductive Medicine, St. Petersburg State University, was appointed chairwoman of this dissertation council. I would like to introduce my colleagues, members of the council: Gagzana Alexander McTirtish, Doctor of Medical Science, Professor of Department of Obstetrics, Gynecology and Reproductive Medicine, St. Petersburg State University. Of a research center named after Kira Evgeny Fedorovich, Doctor of Medical Sciences, Professor of Department of Female Diseases and Reproductive Health, National Medical Surgical Center named after Pirogov. Eduard Vladimirovich Komlichenko, Doctor of Medical Sciences, Associate Professor of in Obstetrics, Gynecology and Reproductive Medicine, St. Petersburg State University, and Vice Director of the Perinatology Center and Pediatrics, named after Almazov. And remote mode, we have Petros Peter Emanuel Papa, PhD, St. Vincent University Hospital of New South Wales, Australia. And according to the federal law dated 23rd of August 1996 on science and states scientific technological policy, St. Petersburg State University was given the right to issue its own degrees, academic degrees, and therefore our dissertation council is in compliance with this law and with the Act of the 1st of September 2016 as a bylaw of St. Petersburg University. According to this law, the dissertation council is legitimate if not less than 2/3 of the membership, established membership of the dissertation council are present, but not fewer than 4 people. Our dissertation council consists of 5 members. Everybody is present, including one in interactive Skype mode. And we have the following agenda today. The duration of our session is not more than 2 hours. It will consist of a short presentation of the chairwoman of on the paperwork that the dissertation council has received and the compliance of this paperwork with the regulations. Not more than 5 minutes. A short presentation of the defender of the dissertation, covering the key issues in the dissertation, not more than 15 minutes. Questions to the defendant in turn, 2 minutes per question, and the answers of the defendant. Then statements from members of the dissertation council with their reviews, not more than 10 minutes per speaker, and then a presentation by the chairwoman with of her review and answers of the defendant, no more than 15 minutes. Then an open floor for discussion. All the members of the audience who want to speak up, please register in the journal for the registration. And when you speak, please introduce yourself. Then concluding answers of the defendant to the questions of no than 5 minutes, and then the academic advisor will speak for more than not more than 3 minutes, and then a discussion of 5 minutes before an open voting procedure during which of the Dissertation Council during which the broadcast will be switched off, and then open voting procedure and the open count of the Dissertation Council, and to enter the results in the protocol, and then taking the decision or not taking the decision on the conferring of the sought degree, and then the concluding word of the defendant, more than 2 minutes. If you have any questions, please ask them. If you have no objections to the agenda, then we'll start with item 1. Before we do that, I would like to remind you that all your mobile phones should switch off. And I also inform you that a live broadcast is on the website of St. Petersburg University, and that is accompanied with a simultaneous interpretation from Russian to English and back. And the first item is by the short presentation by the paperwork, the dissertation of the Dissertation Council has received the following documentation from the defendant, and application for from the defendant addressed to the rector of St. Petersburg University, Professor Nikolai Mikhailovich Kropachev, and then also a review of the academic advisor Popov Eduard Nikolaevich, and the dissertation is accepted for defense on the 29th of the 2019. The membership of this Dissertation Council has been already voiced, has been already read, and so the application to the rector of St. Petersburg University asks for the dissertation to be accepted for defense. It's dated on the 13th of June 2019. Then there's a list of publications consisting of 8 works covering the key issues of the dissertation, including four articles in refereed journals from the list of the Minister of Education of the Russian Federation, and also journals that are indexed by the Web of Science and Scopus, 4 publications and 2 patents. There's the certificate on candidate of science exams that is issued by St. Petersburg University to Shapovalova, Ekaterina, Andreevna, which states that the following exams with a grade excellent were passed: Obstetrics and Gynecology, English and History and Philosophy of Science, Medical Sciences. Then there's a diploma on the with a degree of Medicine issued on the 30th of June 2016 by the first St. Petersburg State Medical University, named after academician Pavlov. And then dissertation in hard and soft copy. The dissertation is in compliance with the state regulations and the regulations of St. Petersburg University. I would like to say that all the above-mentioned documents comply fully with item 12 from section 3 of St. Petersburg State University regulation on the conferral of academic degrees. If you have any questions, please, you have 15 minutes for the for your presentation. Dear ladies and gentlemen, dear members of the Dissertation Council, colleagues and guests. The pelvic prolapse is a common disease that affects more than a third of women over 50. Genital prolapse is associated with a number of functional disorders of the pelvic organs and leads to a decrease in the quality of life of patients and up to including social maladaptation. The most common form of genital prolapse is the anterior-apical prolapse. In Russia, about 50,000 operations aimed at treating this disease and that are performed annually. It is noteworthy that a significant part of them are performed for the recurrence of the disease. One of the popular operations for pelvic floor organs is hysterectomy. However, this approach is not pathogenical, substantiated, associated with a high risk of developing post-hysterectomy prolapse, the connection of which causes considerable difficulties for surgeons, as well as the risk of developing functional disorders of the pelvic organs. Moreover, a third of the women are not psychologically ready to decide on an organ removal, even in the case of the expected effectiveness of the treatment. Today, there are a number of techniques that can achieve high efficiency in the treatment of defects of the apical support level, such as sacrocolpopexy and sacral spinous fixation. But with regards to cystocele correction, in fact, we have traditional performed calcorporography. However, the data of the review carried out in the 2017 indicate that today there is no standardization in the issue of the applied suture material to stored structures and the surgical technique itself. In an attempt to achieve a reliable pelvic floor organ correction in the 2000 numerous mesh implants mounted by vaginal access were developed. The task of these systems was to replace the maximum volume of damaged fascial structures, which was not always appropriate, as the surgery post-operative implant-associated complications showed. It should be noted that the nature of this complication was not always associated with the prosthesis itself, and well-known studies of implant association were performed with gross violations of and including incorrect data. However, a wave of restrictive measures led to the prohibition of the use of mesh and prosthesis for the correction of genital prolapse in a number of countries, and in others it led to the development of techniques involving the use of mesh with prosthesis with minimal dimensional characteristics. The aim of this dissertation research was to optimize the methods of surgical treatment of anterior-apical prolapse of the pelvic organs with vaginal access Achieving this goal was carried out the dynamics of mechanical properties of the main types of suture materials used to reconstruct the fascial apparatus of the pelvic floor, to study the mechanical properties of the myofascial flaps reconstructed using the surgical filaments in question, access the characteristics of the reaction of animal tissues to various types of suture materials, and formulate on the basis of experimental data recommendations for choosing the optimal suture material for plastic surgery of the fascial apparatus of the pelvic floor. To study the effectiveness of safety of surgical correction of anterior-apical prolapse using full-size mesh and prosthesis, as well as the using of hybrid technique for pelvic floor reconstruction at the 2-year follow-up observation, with a subsequent comparison of the results of applying these techniques for the correction of anterior-apical prolapse. To study the mechanical characteristics of suture material, we selected 4 types of surgical sutures that difference chemical structure and biodegradation rate. And it should be noted that manufacturers of such materials indicate that the rate of loss of strength of filaments tied to it in a sample knot. In this regard, after exposure to surgical sutures to the buffer solution for 14, 30, and 60 days, a study of the strength, our results of characteristics that carry out both in the knot and without it. Our results indicate that the strength of all investigated filaments showed a node and 2 or 2 times higher than in a node. Thus, a continuous seam is promising for calporography. So the stages of the experiment. An in vivo study was conducted on 39 laboratory animals, Chechen larib, and after exposure for a predetermined period of time, the animals were removed from the experiment, and material was collected for biomechanical studies of the reconstructed myofascial flaps, studying the strength of characteristics. Turning to the question of the dynamics of the strength characteristic of the suture material in vivo, it is necessary to refer to the information provided by the manufacturer. We can see that there is no such thing as a loss of 100% strength, but there's an indicator complete resorption. But are they comparable? Are they synonymous? As a result of the study found that the resorption of the in vivo, the polydioxinone filaments occurs in vivo is faster than stated. In this case, a loss of 100 strength is noted after 60 days. Thus, after 2 months, the filament stops working, even if it is detected in the tissues. For polyglycarpon filaments, the same pattern is observed. Moreover, after 2 weeks, suture material loses about 90% of the strength. The exception was polyglycolide filaments. Their resorption rate was as claimed, and a loss of 100% strength was noted after 30 days. A study of the biomechanical characteristics of myofascial flaps revealed the lowest strength for a period of 14 days in images where polyglycarpon filaments were used. However, after a month, this indicator was comparable between groups according to accounting for 50% of the native strength. It is interesting that the rupture elongation of the same time was 2 times higher than the native tissue. After 2 months, it returned to normal, which may be associated with remodeling of scar tissue. In addition to the breaking load, an important characteristic is the type of observed gap along the scar or in the area of the clamps. So after 2 weeks, the rupture of all samples occurred along the scar, the reconstructed scar. So consequently, by the end of 2 months, a gap in the clamp area was observed. It is noteworthy that in 2 groups using non-absorbable and rapidly absorbable suture, scar failure was observed. This indicates an equal risk of relapse after when using absorbable and non-absorbable suture material. According to the histological study, there were no differences in tissue responses to absorbable suture material with different degradation periods. And in the case of non-absorbable suture, an inflammatory response was chronic. Summing up the results of the experimental study, we can conclude that for the reconstruction of fascial structures of the pelvic floor, it is advisable to use a continuous seam with a multi-filament thread with an average resorption time. The clinical phase of the work was carried on the basis of Pyrgos St. Petersburg State University. The study included 288 patients. The patients were divided into groups according to the scope of the forthcoming treatment. The first group, the pelvic anterior full-size mesh implant, was implanted. In the second, a hybrid technique of pelvic floor reconstruction using the endoprosthesis tape was used. Examination of patients that the pre and post-operative stages included an anatomical assessment with the definition of the stage of prolapse, the study of functional indicators of urination, as well as then an assessment of the quality of life of patient. The first group included 145 women, second 143. The study of the post-operative characteristics of patients revealed the homogeneity of the second group according to the main indicators. The implantation of the pelvic endoprosthesis was performed according to the trocar technique. The restoration of the apical support level was carried out by conducting the posterior sleeves through the sacrospinous ligaments. The hybrid technique for the reconstruction of pelvic floor is the restoration of the apical support level by implanting of the endoprosthesis tape with its bilateral passage through the sacrospinous ligaments, reconstructing the pubic cervical fascia by subfascial colporrhaphy, and creating a unifying design by linking the colporrhaphic suture and the filament that fixes the endoprosthesis to uterus. Based on the obtained experimental data, a multifilament polyglycolide filament with an average resorption time was used for subfacial calciferous. Comparison of the main intra and posterior parameters between the 2 groups revealed a statistical significant decrease in the duration of surgery, the volume of the intraoperative blood loss, and the duration of hospitalization. Group 3. The latter can be in Group 2. The latter can be explained by the presence of a group with a large implant of 3 cases. As well as twice the frequency of atony of the bladder in the early post-operative period. Also in this group, the greater incidence of the de novo urinary incontinence as well as the presence of 2 areas of pain are noteworthy. The 2-year effectiveness of the performed intervention in both groups exceeded 90%, as well as patient satisfaction. Thus, the hybrid technique for extraction is characterized by the shorter duration of surgical treatment, the duration of hospitalization, less intraoperative blood loss, reduced risk of bladder damage, reduced risk of developing atony of the bladder, stress urinary incontinence, pain surgery after surgery. With the same performance indicators. Thank you very much for your attention. If you have any questions, thank you. Ekaterina Andreevna. If there are no questions, please, we have the time for reviews. We have no external reviews. Then we have reviews of the members of the Dissertation Council. The first one is by our guest, members of the Dissertation Council, Peter Petrus. He has kindly agreed to take part in our Dissertation Council, but he's very far away from us. Please, Professor, could you read your review, please?
Sorry, what would you like me to read?
Вы хотите, чтобы я прочитал?
My assessment, is that right?
Вы можете изложить.
Yes, you can either read it or do it in a sort of free form. Freestyle.
Okay. My assessment is, firstly, this attack two parts.
Работа состоит из двух частей.
The experimental animal part is actually very good work, and in my view, it is sufficient to award this candidate her doctorate. There was some very new, some novel novel discoveries. A very important discovery was that in terms of strength of the wound, it was irrelevant whether one used non-absorbable sutures or absorbable sutures. And that is very important because most surgeons believe that using non-absorbable sutures gives a greater strength. In fact, it causes more problems because at least 10% of these cause either rejection or granulations or whatever. So that was a very important discovery. The other one was also important, that the tearing out of, if there was going to be tearing out of the wound, it tears out equally in all of the types of sutures at 14 days. So these are very important observations. The third important observation is that when one is doing suturing, the continuous suture, whether it be Holden or some other type of suture, is in fact superior to the knot type suture. So that was very, very good work, and it was validated by testing, by tearing out on the tensiometers and histological. The histology was quite good also. The one thing that I would have liked to have seen was to test the type of collagen formed at 2 weeks, 2 months, etc. We know the answer to that. I actually did it in my own doctorate a long time ago. And initially, it's collagen 3 that is formed, which is elastic, and that explains the extension. And then that converts within a couple of months to collagen 1. Coming to the, am I going on too long? Coming along to the two surgical trials, the first and the second. I actually have a question. Is this the right? Look, I'll sum up and I'll give the questions later. They were very good studies. What was relevant to me, and I will ask these questions later, was that the rate of de novo urge incontinence in the first group was twice that of the hybrid group, and the rate of de novo, did I say stress incontinence? Stress and urge were both double in the large mesh group compared to the hybrid group. This is an excellent doctorate, and I would recommend that it be awarded. Thank you very much.
Вам удобно сейчас задать вопрос?
Can you ask your question that you wanted to ask?
You want me to ask the question?
Yes, the question. Yes, your question.
Well, the question is, Ekaterina, when you, in the first group, you put a large mesh in, did that mesh cover the bladder neck or not? In other words, in the surgical methodology, when you had the arms coming through the transobturator, did the mesh sheet extend across the bladder neck, or was it always behind the bladder neck? Do you understand the question? Let me, please tell me if you did not understand the question, and I'll put it in another way. Would you like me to?
Peter, if I understood you correctly, you just asked if the implant was placed behind the bladder neck, yeah?
Yes, or was it across the bladder neck?
Okay, thank you for...
Вопрос Питера Петреса состоял, в общем...
We discussed it. We discussed the question at a conference, whether there was an observed fixation of the tissues in the bladder at the expense of polyfibrillary process, which led to the biomechanical mechanical characteristics during coughing or other stress and so we think with other stresses. I think that was the case. Yes.
Across the bladder. I'll tell you why I'm asking the question. I have a book here. And on page 139, we discuss the Tethered syndrome, and those mesh sheets which go across the bladder neck, yes, they cause immense fibrosis in the vagina, and in my experience and recommendation, they should not be used. The hybrid is a much better operation because it does not fibrose the vagina. But 10%, about 10% of those mesh sheets cause what we call the tethered vagina syndrome. That is a very specific syndrome. On page 239 of the Russian translation of the book, and the symptoms are very specific. The patient will tell you that when they get out of bed in the morning, there is a massive loss of urine immediately after they put their foot on the floor. Also, such patients do not have very much stress incontinence when they cough. So my question is, did you observe any such patients? Or more importantly, did you look for it? Because it is not a very well understood syndrome. It is an important part of the integral theory, but it is not very well understood, and not many doctors looked for it. For instance, I think in the Lancet trial by Glazner, there were cases of massive urine loss which were not explained de novo after the operation of mesh in their patients. So the question is, Ekaterina, A, did you look for tethered vagina? And B, if you did you have cases of unexplained massive urine loss after inserting the mesh? That's the question.
За вопрос.
Very much for you. In our group, we didn't observe any cases of this syndrome, tethered vagina syndrome. We didn't see it. We put this question, and no complaints of this kind on urine loss when the body moved when the bladder was full. No one told us about it. And de novo stress retention loss, we did study that at full bladder with stress tests. Thank you very much, Professor Ekaterina Andreevna. Thank you. We continue our session. Please, questions should be related to the topic of the material. Please, Evgeny Fedorovich Kira. Thank you very much. Dear Teriko Alexandrovna and members of the Dissertation Council, colleagues, I would like to note that this research and the presentation of this research are very relevant because the problem of genital prolapse and stress incontinence have not been studied or have not led to a universal surgical methodology, and therefore this study that is oriented at the optimization or the improvement of surgical correction of pelvic floor prolapse is very relevant. And you know that pelvic floor surgery started in the 19th century. Several surgical methods have been suggested. These were mostly surgical variants with patients' own tissues, but after a while we found out that they had short-term effects, but unfortunately the disease came back and the surgeons were not happy, and so the medical science and our understanding of the structural changes in the body and the female body in particular with age that meant that the patient's own tissues could not cope with the process that are characteristic of this age group, and therefore new suture materials have been developed, and this revolutionized our understanding, and they replace the get good the other absorption materials are now used with a period of its resorption. They allow us to change our treatment methods of this pathology. It's very useful for any clinical doctors. This work is very important. Has two parts. I think that the first part is enough for this degree because this is an experimental part, and we lack such experimental studies because this directly relates to clinical practice. A very representative group of experimental animals, 39 species, and they were operated on according to a certain methodology, and very objective, objectively concluded results were obtained, and that reflect on the clinical part. And these attempts to get away from the complications of any excision has to do with erosion and of the tissues and other complications. So FDA didn't recommend such tissues, such materials to be used. I think that this tactic is good, and what I like is that it's a hybrid approach. That we use own tissues of the patient and points of fixation, and also implants, and that minimizes the reoccurrence of the disease. And the dissertation is fantastic, and it's been completed in the full format, good literature review, what has been achieved to date, and what we need to do to achieve even better results. Second one, the second part is dedicated to the methods, methodological. And the clinical parts are of a very high standard. They demonstrate contemporary approaches. The clinical results have been demonstrated in the presentation. They've been published in many articles, and these publications comply. They're published in high-rating journals, and I think that this work is of very high theoretical and practical significance. I had no conceptual questions, maybe some comments of a discussion nature. I don't like the term prosthesis because traditionally this is something that replaces organs. So prosthesis is not the right word. So endoprosthesis is the right word, because the endoprosthesis is intrusion of some parts into the body, and somewhere you use endoprosthesis, but and then there's another term, uterus-sparing, seal. Retrocili, well, I'm not sure. Maybe what it's not a term I'm aware of. Maybe it's it's an English term, a translation of an English term, maybe. Maybe compartmental approximation is of mathematics, and this we are now in the philology faculty, and maybe philologists will help us to sort out the terms, and so the pelvic. I would like to say that uterus-sparing vaginal mesh-based reconstruction of the pelvic floor for the anterior-apical prolapse clinical experimental study meets the main requirements of St. Petersburg University, and so therefore I conclude that Shapovalova Ekaterina Andreevna is entitled to be conferred on the degree of candidate of medical sciences with a specialization 140101 Obstetrics and Gynecology. Article 11 of the mentioned Act of St. Petersburg University. Thank you very much for your comments and for your position. And the next review, please, by Kamilchenko. Dear Tariko Alexandrovna, dear members of the Dissertation, we are witnessing a very interesting defense, a very good paper. Thesis. I'm totally endorsing what the previous speakers said. He's a luminary in this field, and we've been cooperating with him. I like the work very much. The experimental part is very unique. We don't see much of it in contemporary academic works. That has to do with reconstructive surgery, plastic surgery. I agree with Yuri Fedorovich that we don't have much of a criticism, but since I have to be formally critical, and criticism should be included in my review, I would like to say the following. First of all, as far as the academic relevance, such materials were studied to reconstruct the pelvic floor in vivo and in vitro, and characteristics were identified at different stages of exposition, histological and of myofascial flaps were studied in terms of such materials, and hybrid approach to the restoration was studied, and for the first time there was a comparison of effectiveness and safety of the surgery in polyfilament mesh implant. As far as the work, it covers 150 pages. It includes an introduction, 3 chapters of clinical studies, conclusion, list of sources, there are 32 tables, figures, and over 30 tables. The translation, English translation, is provided, and I will not dwell on the characteristics of every chapter because this is a well-written work, very coherently written work. I won't waste our time here on this, but as far as the questions are concerned, when I read this work, I have a very small question, a very understandable questions, but maybe in routine practice, many specialists would ask you this question because why thorax? Because clinical practice, 90% ethibond is used. Why do you? Thank you very much for your question. If I compare two different filaments, they're usually compared, and that thorax is an analogous to ethibond, but it's not analogous in structure because it's a multifilamental, and ethibond is a pseudo filament because complex filaments have such negative properties. Ethibond is a complex filament and have such negative properties as weakness and capillarity, i.e. there can be conduits for infectious processes due to their multifilament nature. Poplin filaments are monofilaments and are devoid of the above disadvantages. However, minor filaments have less comfortable manual properties and require a large number of knots. Phthorus, being a pseudo-monofilament, combines the advantages of both of these types. Thank you very much. As far as my conclusion, the dissertation by Shapovalova Ekaterina for organ sparing vaginal mesh-based reconstruction of the pelvic floor for the anterior-apical prolapse clinical experimental study meets the main requirements stated by the order 6821-1 dated September 1st, 2016, and therefore Shapovalova Ekaterina is entitled to the degree of Candidate of Medical Sciences in Obstetrics and Gynecology. Thank you very much, Eduard Vladimirovich. Thank you very much for your answers. Next review. Dear Enrico Alessandro, dear members of the Dissertation Council, dear colleagues, first of all, I would like to thank the organizers of this Dissertation Council for the honor to speak here. And as far as the dissertation, it has made a very good impression on me by the academic significance. It's very fundamental in its structure, although it's very clinical in nature, and I would like to congratulate on the dissertation author on this because this dissertation council has already noted that the experimental part is of very fundamental character, and this defender is very well versed in technical details, technological details of every product that is studied in the dissertation. I am very impressed by the ease of with which the defendant talks about different surgeries. It means that she works with this and to develop a technique of her own at this age is very extraordinary, and I would like to thank you for this study. As far as the structure of the work, I would like to say that both the clinical part is structured in a very traditional way. All the results are sound and very good statistics, very good illustrations, and the presentation showed that, it demonstrated that as well. As far as the structure of the dissertation, the structure of the whole work is very traditional. There's a literature review, materials and methods. By the way, they're very well and studied and in detail, and very detailed explanation of the clinical part. I liked the work very much, and the question I would like to ask as part of the discussion actually has received an answer already during the discussion. So I like the questions and I like the answers. I will just read the concluding part, the dissertation by Ekaterina Andreevna Shapovalova on the topic organ-sparing vaginal mesh-based reconstruction of the pelvic floor for the anterior-apical prolapse. A clinical experimental study meets the main requirements stated by the in the order of September 1st, 2016 of St. Petersburg University, and therefore Shapovalova Ekaterina Andreevna is entitled to be awarded the degree of Candidate of Medical Sciences with specialization 140101, Obstetrics and Gynecology. Thank you very much for the impression that you shared with us of the dissertation. And now I'd like to make a concluding review. I have every reason to state that the work is an integral assessment of the heritage combined with contemporary approaches. The work talks about all contemporary methods of pelvic floor treatment and surgery. Many surgeons use very subjectively different methods, and especially vaginal access treatment. These treatment methods, the surgery methods, include endoprosthesis, and therefore, in order to avoid complications. And I would like to say that the author made a very honest assessment of what happens after a surgery of this kind, and the results can be applicable to our clinical practice, and this is because it talks about the most frequent form of prolapse and is prone to reoccurrence in very many cases, and a very detailed study, a horizontal concept of pelvic surgery, floor surgery, is incorporated into the overall picture, and the prosthesis part is added as complementary. And if the effectiveness also this is relevant for the state policy of import substitution so that the Russian implants would be used and produced, and therefore this is very important for the practical use in Russia, and also it has a very important application in theory. It contributes to theory, to the pelvic floor dysfunction treatment. The work is logically structured, and also the answers are very well answered, and I found answers to my questions, but there's only one question that I would like to ask. I would like to just ask one question, is that please specify the perivaginal defect, whether they play a part in the prolapse. If you look at different techniques, the ultrasound and MRI techniques are more reliable, and these studies are not routinely performed. It should be noted that to date, works have been published that review the role of perivaginal defects in the pathogenesis of anterior-apical prolapse. In our clinical, more than 2,000 hybrid reconstructions were performed, and no case was additional perivaginal plastic surgery performed. And so the dissertation of the of Shapovalova, Ekaterina, Andreevna on the topic uterus-sparing vaginal mesh-based reconstruction of the pelvic floor for the anterior-apical prolapse, clinical experimental research, meets the requirements stated by Order 6821.1 dated on the 1st September 2016. And therefore, Shapovalova Ekaterina Andreevna is entitled to be awarded the degree of Candidate of Medical Sciences in Obstetrics and Gynecology, specialization number 1401. And therefore, Ekaterina Andreevna, do you have any commentaries that on the comments that yes, I have a commentary. It has to do with Alexander Nikitich's review. He said that a new technology was developed by me. I would like to make a note. This is not my technology alone, but it was developed by a team of my colleagues, and their headliners in these methods, and only as part of a team you can develop such a technique. And you already said that import substitution, the Russian-made endoprothesis of a tape type that was produced in Russia by a company that is very supportive and very responsive to our needs, and they develop together with us and develop and with our methods. Thank you very much for the remark, but we understand that we are, as co-authors, we know how important each co-author's contribution is. So don't be over honest. Thank you very much. The next item is an open discussion that you can. You have any comments from the floor? You can have. You can ask a question or make a comment. If there are no comments or questions, then I would like to ask the academic advisor of this this dissertation, Professor Popov. Thank you very much for giving me the word. Dear Teriko Alexandrovna, dear members of the dissertation and dear guests, we are witnessing a study done by a practitioner, by a wonderful clinicist, Shapovalova Ekaterina Andreevna. It was not a supervision on my part, it was collaboration really, because Shapovalova Ekaterina Andreevna is an established doctor, and it was actually interesting for me to learn from her. And Ekaterina Andreevna is very modest and in good. She always received my comments and recommendations with due tact and complied with without resistance. And I understood. I understand why we have such a good dissertation. She comes from a medical family. She is following in the footsteps of wonderful doctors in her family, and we hope that we will hear about their achievements as well. Thank you I would like to extend my thanks to the members of the Dissertation Council for the comments, and I'm totally convinced that Ekaterina Andreevna is entitled to the degree. Before we do the voting on conferral, non-conferral of the degree of St. Petersburg University in Medical Sciences, we'd like to discuss it between ourselves. I would like the broadcast to be switched off, and the members of the audience that are not part of the Dissertation Council are asked to leave the room for this duration of this discussion, and we'll invite you back in after we finish. Thank you very much. Please come in. Invite the people. So, dear ladies and gentlemen, dear colleagues, dear guests, we are now starting an open voting procedure. We would like the broadcast to be switched on and make sure that the broadcast is working. This is a very decisive moment of the Dissertation Council session. I put to the vote individual vote the resolution to confer the degree of medical sciences, candidate of medicine. I would like to say that 2/3 of the Dissertation Council should vote in favor of the decision, and this is in compliance with. Member of the Council, Xan Alexander, I am in favor of the decision, of the resolution. Kiri, in favor. Kiri Evgeny Fedorovich, thank you. Yes, you're in a haste to voice your positive opinion. Eduard Vladimirovich Kamlachenko, I vote for the decision and I lift my hand. I also vote for it because I think that the work is well done, and then Peter. Oh, sorry, Peter, Professor, your opinion, your vote?
A very nice doctorate. Thank you. Vote for it. Yes.
Спасибо вам.
Thank you very much. Sorry for a little relapse. And so it's easy to count the votes now. Out of the 5 participating members of the Dissertation Council, 5 voted in favor, no abstentions, no nays, and therefore the decision to confer a degree of candidate of medical sciences is taken. Please, Ekaterina Andreevna, your chance to say something. Dear members of the Dissertation Council, dear Professor Petros, thank you for finding the time to participate in this event in my life and the defense of the dissertation. I would like to thank my parents, my loved ones, because this dissertation is a work of that is part of my upbringing and of the efforts that my parents showed me where to direct my paths, and therefore, and also thank you all my colleagues of the clinical team, and thank you for the support. Thank you for coming and sharing this moment with me. Thank you very much, Ekaterina Andreevna. The dissertation council session is declared closed. Thank you very much, everybody.